Hi, I'm Makayla, and here recently I studied an interview between the NBA athlete Stephen Curry and Dr. Fauci, an American physician and immunologist who served as the director of the National Institute of Allergy and Infectious Diseases since 1984, who has done a numerous amount of interviews in regards to this COVID-19 pandemic. Dr. Fauci has proven himself to be an astute and very knowledgeable individual by showing his driving commitment to give detailed information and statistics for public consumption when it comes to questions that the general public may have, as well as problems that we face. He also has proven himself to be a respected and reliable expert in his field of work by the recognition that he's received and the numerous amount of prestigious awards for his work that he's done towards global health. Dr. Fauci has also studied at the Biomedical Research Unit and Medical School of a private Ivy League university, Cornell University. Some challenges of leading and supervising healthcare environments pertaining to this coronavirus are, first, administering these tests. The healthcare system was not prepared to give these tests to patients at such a high demand that, we are in need of. There are two types of tests, one which is used to see if you are currently infected with COVID-19, and another which is used to see if you at some point were infected with this disease. That test, it actually is an antibody test to check for the virus. Secondly, healthcare environments are making the elderly and those with a serious comorbidity a priority for this COVID-19 treatment. Sadly, there are younger and more healthier patients that need testing. However, they're being turned away if their symptoms aren't at an extreme level, sadly ending in death. Lastly, something that may be difficult for the healthcare environments will be just simply counseling the patients about the COVID-19. If they are infected, it could be very hard to give them that piece of information because the virus is very endangering. So simply, give patients the broad picture without sugarcoating the information. For example, just let them know that according to the data, there has been an 80% data capture of those people being infected recovering well. Just try to take the burden off of the patient. Make sure that they take proper precautions to prevent the spread of this virus to others who may not be infected. Dr. Anthony Fauci, who serves as a healthcare professional, is also stressing to the public the severity of this disease. It's similar to other viruses like pneumonia and the flu, but it is much more transmissible and very serious, way more serious than the seasonal flu. With comparing statistics, COVID-19 is at least 10 times more serious than your typical flu that you will get, year-round. Next, prioritizing the mask and supplies for those who need the most, like individuals working in healthcare fields, working first hands with those that may be infected is very important. If you're infected, wear a mask in regards to preventing this disease, the spread of the virus to others. However, we should be thoughtful on who really needs these masks and supplies because those frontline individuals like healthcare providers, doctors, and nurses who are attempting to treat others that have this illness must also protect themselves while they protect us. Lastly, the general population who is wearing these masks get the assumption that they are 100% protected from this infectious disease when in all actuality they're not. It's an estimate of about 50% protection, but we must do the proper things to put an end to this pandemic, such as washing our hands casually, avoiding big crowds, and most of all, staying home as directed. As Dr. Fauci has stated, this virus is very severe, it's very serious. Just follow the basic, rules that were given. Stay home, avoid large crowds, and wash hands for 20 seconds. It doesn't have to be hot water. It can be any kind of water. Soap and water. Wash your hands. Stay clear from touching your face to help solve this pandemic.